colleagues from the Trust. If Lila, if you're ready, we'll make a start, please. And just the first substantive item of business is the nomination of a chair of the subcommittee for the incoming year, and it's an SDLP nomination for this year. So if I could invite a nomination, please, for the position of chair. Yep, Councillor Gannon.
Thank you, Chair. Just like to nominate Councillor Coyle as chair, please, and thank you.
Okay, thank you, Adam. And Councillor Warrington.
I'll second that. Thank you.
Okay, thank you very much, Victor. So, Councillor Coyle, you've been formally proposed and seconded as chair. If you're happy to accept, John, I'll hand over to you for the rest of the proceedings.
Thank you very much, Alison, and thank you for the proposal and seconder to be chair of this committee. A great honour, and I will do my best to keep everybody in line, and we'll get the answers out as quick as possible. So I would like to welcome everybody to the Health and Social Care Services Subcommittee on the 19th of July 2022. And just for record, I have a list of people that are going to be here. So we'll welcome Neil McGuckian, Chief Executive, Geraldine McKay, Director of Acute Services, Dr. Brendan Lavery, Medical Director, Tom Cassidy is Interim Director of Women and Children's Services, Emer McCauley, Director of Finance, Karen Hargan, Director of Human Resources, and Oliver Kelly, Head of Communication. So you're all very welcome. And then we have our own members and councillors and staff here as well. So I'll move on to item number 3, is to sign minutes of the previous meeting held on the 7th of June, and I will do that when later. Number 4 is declaration of interest, members. Has anybody any declarations? I take that as no. So thank you very much. Item number 5 is matters arising from the minutes. So I will go through pages. So page number 1. Page number 2, page number 3, page number 4, and page number 5. Can I have a proposer and seconder for the minutes? Councillor Thompson, thank you, and Councillor Armstrong. Thank you very much. So item number 6, members, is to receive an update on the interim arrangements for the Trillick-Dromore GP practice. And Neil, am I passing over to you?
Okay, thank you, John. First of all, just to confirm the arrangements, we have been asked at short notice by the Department of Health to take on the contract for the provision of GP services in Dromore and Trillick until the 31st of March 2023. So we want to emphasise the fact that this is an interim arrangement. I would want to also highlight that the maintenance of the rota for GPs and the provision of GPs has been retained in terms of responsibility by the SPPG, which is basically an arm of the Department of Health. The most significant things the practice continues to operate. Clearly, we're still finding our feet. It's only a matter of a couple of weeks since we've taken it over. But we've systematically gone through the practice, the different aspects of the practice, working with our colleagues in SPPG to ensure a service is maintained to the patients of Dromore and Trillick. We reached very successfully an agreement to recruit a number of additional staff into the practice, as would be the case for an MDT. First of all, a physio, a social worker, and a social work assistant, to think of the 3 posts we've reached agreement on. And these will be funded by the SPPG. And the purpose of that is to make the practice more sustainable and more attractive into the longer term. and we're looking to get those staff in as quickly as possible. As I said, we are in the process of due diligence, going through every facet of the practice to assure ourselves that the services are robust, and we will systematically work our way through this in the coming weeks. But it's a challenge for us because we're not just delivering GP services. We don't one of the few trusts who don't provide even out of hours GP services. They're provided by a consortium and not as part of the trust. But we're doing it, and as requested by Minister, we'll do our best in that regard. I don't know if any of my colleagues want to add anything to that at this stage. I suppose I should say, look, from an accountability perspective, it'll be Donna Keenan, my nursing director and director of older people services, who will manage this contract on our behalf. Sorry, Brendan.
No, I was just going to echo some of the points you're saying. I'm Brendan McGrath, Assistant Director of Nursing. I'm representing Donna Keenan today. Donna's on leave. So I just echo the points that Neil has already reported. And just this is a work in progress for the Trust to maintain the services for the people of Dromore and Trillick.
Thank you very much. We will go now to members. Councillor Josephine Deehan.
Thank you, Chair, and congratulations on your appointment as Chair of this group. It's a very important role, and certainly we all have a lot of anxieties regarding the provision of health and social care services going forward. And I think that this is an important forum where we can liaise with our Western Trust colleagues in terms of ensuring provision of those services to our District Council area. So first of all, I want to thank Mr. Guckey and Neil for his presentation. I can say that it is a great relief to me that the Trust has taken over this GP contract. It had been a great source of concern within the community and certainly within our profession. Members will be aware that the situation in Dromore and Trillick is critical, but that many other practices within our District Council area are similarly endangered. So I do believe that a new model needs to be found. I appreciate the work of the Trust in stepping forward to take on this contract. It's a very significant commitment. And I'm grateful to Donna and Tom and their team for the support that they have given in this regard. I believe, and I have expressed on a number of occasions, Chair, my feeling that it would be a complete disaster for both patients and the profession alike to have dispersal of this large patient group. So I appreciate this is just an interim measure. So I suppose my first question is really, how can we best use the 6 months or so that we have at our disposal to work out a more sustainable provision? And secondly, I just wanted some more details on the governance arrangements that are in place to support Dromore and Trillick. Ordinarily, where a GP holds the contract, there would be a lead for clinical governance within the practice. Obviously, those are very important issues to ensure that we have in place. And I just wondered if Neil or one of his colleagues could comment more specifically on those governance issues. Thank you, Chair.
And in terms of your first question, Josephine, you're absolutely right. The objective of this exercise is to make the practice more sustainable into the longer term. So the approach of the Trust will be to stabilise first, to get a grip of all issues from a practice base, from a facilities base, from a staffing base, to actually make the practice much more attractive into the longer term, into the medium term. So initially, our job is to stabilise things, and then as we come through toward over the next couple of months, we will then look to get into dialogue with SPPG to have an exit strategy for our involvement. And clearly, that's in everybody's interest to have a more sustainable model. In terms of governance arrangements, I have to confess that we are in the middle of due diligence in this practice. So we're still firming up on our clinical governance arrangements. We don't really employ GPs. I have one GP whose role is to act as an interface with primary care. So we have an option to remove her from that role and give her this clinical governance role, which is not really in anybody's interest. So we will likely, we're considering currently how best to solve the clinical governance issue, but we recognise it as an issue, Josephine, and it will be resolved in the coming weeks.
Thank you, Neil.
Thank you, Councillor Deehan. Next, we have Councillor Tommy Maguire. Tommy.
Good, John, and congratulations. Thanks, John, and congratulations for your appointment in the chair. And again, first of all, I have to welcome this move, and certainly it is a move, because we attended several meetings, GP federations, etc., where some of our members and were reminded that the trust could possibly put in a GP in this case, and we were informed that this wasn't possible. So I want to welcome it, that it is now possible. But again, I think I have to speak up for the people of Erne East, the Rosslea area, which historically lost their GP many years ago. And there was no solution to that problem for those people. I believe now that even the Lisnaskea practice that took on the majority of those patients is now under severe stress, having lost nearly half the GPs that they had to cover the Rosslea area. So I wonder now, Neil, that this decision has been made, and I can understand it's new to you, it's a new idea. But again, when we as elected reps hear statistics about the fall in GP services of 9% across the 6 counties, but yet when you dig in deeper, it actually is 16% in the West. So as elected reps, we are continually hearing from every department how the West loses out. And as councillors, we're blue in the face, pointing out the discrepancy that we, especially in the Fermanagh area, because of our unique rural position, lose out on services. And we're impacted more severely than any other area. We have to have innovative ideas like this to sustain our health service. Our people out there do not recognise the difference between the trust, the SPPG and the GP Federation. The people on the ground in rural Rosslea and again in Dromore and Trillick see the health service as the service that they expect when they walk through the door of a GP or a hospital. So it definitely is time for a new way of thinking, especially with regard to our unique position in the West. So Neil, do you anticipate that that there could potentially be retrospective GP placements in our rural district, or could you see that this model could be sustained into the future? Margaret, thank you.
Cheers, Tommy. Okay, Chair, if I answer that.
Yes,
basically,
Neil,
I suppose this sounds like I'm nitpicking, Tommy. That's not what I intend at all. But I'm still learning my way through the minefield that is GP practice. But the trust hasn't put a GP into the practice. I just want to emphasise that it's the SPPG have retained that responsibility. So we wouldn't know how to go about appointing a GP because we don't have any GPs. So it's not a case of just putting a doctor from the hospital into a practice and hoping for the best. It's much more important than that. We have to get GPs who are experienced GPs to work in the practice. So that's the first point. The second point, you've raised a very good point. You have a 16% reduction in the West. I can assure you, the Western Trust has highlighted that time and time again to the Department of Health, because we recognise that we are so reliant on primary care as the first port of call in terms of much of the interface we have with our patients. It's such a vital cog in health and social care in Northern Ireland, and you're right. It's adversely affecting the West due to a number of factors, mainly the rurality and things like that. So there needs to be a different plan. I would highlight that that would be up to the Department of Health, SPPG, and others to come forward with a reasonable solution to address that. And I've certainly raised it personally with the Permanent Secretary. almost identical words to you used, Tommy. We need a new model. We need to look at this another way. And I don't know what that is yet, but I think the starting point will be to get this practice stabilized, learn a bit more about GP practice, and learn more to see how we can do things differently. Your final point about Rosslea, I wouldn't be raising expectations in relation to a retrospective move towards Rosslea. This has been a real challenge trying to address the Dromore Trillick arrangement. It's been a major drain on the management of a number of directorates, many directorates in the trust actually. So we are having to do things we've never done before, set up whole completely new processes and a whole new assurances. And Josephine's quite right about the whole governance side. The whole clinical governance side is really important, and it's a whole new area for us. So whether we can find a magic bullet for this and then we would transfer it, I'd be very surprised. This is going to be just long, hard work over the coming months, in my view. Sorry to be not too optimistic. I think it's better to be realistic.
Thank you, Tommy and Neil. Next, we have got Councillor Barry McElduff. Barry.
Thanks, John, and good luck, John, in your time ahead as chair of this important subcommittee. I suppose following on from Tommy, the question still remains, was there an absence of will somewhere in the system when the Rosslea crisis, reached its fullest point? And, it's good to see that there is will to take on the Dromore Trillick, immediate challenge. It's good that that's being done. I suppose my questions, Chair, to Neil would be along these lines. How close are we to possible collapse in other GP practice areas? I was speaking to GP in an area where you would ordinarily think that the practice is robust and strong and likely to survive. And yet that GP told me that if, for example, the HR situation changed even slightly, if, for example, a GP went off on leave, it would leave things in the balance and that strong practice. So that surprised me. So how close are we to possible collapse of other practices? And then if you take the southern sector of the Western Health Trust, I would imagine that's where the great challenges lie more than the northern sector of the Health Trust. So is there going to be a holistic focus on the Western Health Trust area with regard to GP services, and particularly in the rural areas in the southern sector? Thank you, Chair.
Cheers, Barry. I suppose I'm going to be very careful what I say here. Primary care is challenged throughout the UK. We have pockets in Northern Ireland, particularly in the southern sector of the West, which there are a number of practices I'm informed that are vulnerable. But all I can do, Barry, at this stage is deal with the problem I have, the known problem I have in front of me. If we go back to Tommy's point, we are raising with the Department of Health that we need to do this another way. We need to find another way. We can't just come running to the trust every time there's a crisis, because eventually we'll have to say, well, we don't have the staff either. We don't have the staff to manage this. We don't have the manpower. We don't have the time. So to me, it's, I think the Department of Health are considering, new models, new approaches, but I think they're going to be quite some time down the road, folks. And I don't know what they are at this stage. We're still learning, Barry. We're still learning about primary care. So I'm going to be very reluctant to put myself forward as an expert in primary care, I can assure you. But we'll give us a while, and we will get into it, and we'll start making suggestions to the department and others indeed. In terms of the holistic approach, you're absolutely right. It's my understanding that federations, etc., we're supposed to be bringing that sort of support mechanism into place, but that hasn't really worked. So we have to look at other mechanisms then to try to support each other, for GP services to support each other and try to get through this very difficult period. It's not much of an answer, Barry. Apologies, because I don't really have an answer at this stage. But all I can assure you is we'll do all our best to deliver the service for the patients of Dromore and Trillick.
Thank you, Neil. And next we have Councillor Victor Warrington.
Thank you, and well done, John, as chair. Thank you, Neil, for an answer. I'm not going to go over old ground. I'm actually based in the Earnest area and was very involved in the Rusley situation when it was going strongly. And I know certainly Geraldine's on the meeting. I think Geraldine was probably one of the people who was at a meeting in Rusley, which I was at myself, which Geraldine, I don't need a reminder, was quite a what's the best word to describe it? Exercised. But look at, we know that the problem out there is the severe lack of GPs in Northern Ireland at the minute. They're just not there to put in place. I know certainly Tommy mentioned Lisnaskea there. Lisnaskea is a concern at the moment because Lisnaskea is obviously covering Rosslea and Newtown Butler at the moment, and I know that they're down to I'm not sure how many exactly it is, but I think they're down to maybe about 4 GPs at the moment for a massive amount of patients that's out there, and it's certainly a concern. I know that the Western Trust, that the GP services and getting GPs into situ is not really within their remit, but certainly Dromore and Trillick certainly proved that yes, were pulled in and had to go in there and sort that problem out. So I would say we can't rule that out happening again in the future. We certainly don't want it to be happening overly again. But I think Lisnaskea is a prime example. Low number of GPs with a massive patient number, and I know that there is a lot of concerns in the Lisnaskea area as we go forward. Probably can't do anything retrospectively in Rosslea, as you said, and it is sad because I'm Rosslea born and bred, and we were always used to our GPs in Rosslea. We just basically there was no pre-booking anyway. You went in when the surgery was on, and you could have been in a waiting room with 20 people in front of you, but you just waited in the queue if you needed to be seen. But it is sad, yes, that the GPs are no longer there, but there is no immediate fix going forward on them. Thank you.
Thanks, Victor. You're absolutely right. I think this isn't the answer, but you know what, we'll do our best in the interim.
Thank you, Neil. Next we have Councillor Errol Thompson.
Thank you very much, Chair. And can I first of all take this opportunity to congratulate you on achieving the chair of this very, very important subcommittee. And it's just really been highlighted in this issue how important this committee is. I welcome the interim arrangement, as others have said, but we do really need to get to a position where we're not going to have these debates on this issue every meeting that we have. And we had that Rosslea situation for quite a while, and now it's Dromore Trillick. Neil, are there any other parts of our district, to your mind, that we're in a similar vein on? Because I'm aware of obviously the difficulties in the ordinary constituent out there that we deal with and resident. I think it was Tommy said it earlier on. They don't recognise any difference between the trust and the GPs and all the other agencies and bodies that we have within health. They don't recognise anything we got there, and to try and get that across them is quite difficult actually. So can you envisage any other GPs areas at this minute in time that are in similar difficulty? Thank you.
I'm going to be very careful here, Errol. I don't have that information in front of me, but going back to the comments that Tommy made earlier, the 16% reduction in the West, most of that, as Barry has said, is mostly in the southern sector. So quite rightly, there must be other practices that are vulnerable, because that's just the people who've already left. So we will have a range of practices which are vulnerable, and vulnerable doesn't mean they're closing. It's just vulnerable means that if a GP gets gets ill or isn't able to work, whatever, that can pose a big problem. But again, I just want to emphasize, we've been tasked with doing managing this one practice, and we will do our best in that. Going back to your point about the public not recognizing the difference between primary care and trust, etc., you're sort of pushing us towards removing the independent status of GPs. And that's way beyond my, I was going to say my pay grade, but way beyond my remit. But if that's something that the Northern Ireland Executive wanted to do, well then that's something they can bring in. But it would be a very big departure from the UK approach to primary care. But I think in a decade's time there will inevitably be some sort of hybrid model. But what that will look like, who knows? And I don't want to really declare my hand at this stage because I haven't really thought it through. It would be a very ill-informed position at this stage. But maybe if we get a bit of learning from this exercise, we can then help the department shape the future for primary care.
Thanks very much, Chair, and thanks, Neil, for your reply on that issue. And I suppose Commissioner Dr. Deehan's on here as well, and she's been on speaking earlier, and she would probably she would be disagreeing with my thinking completely. But I have made that statement. But we have to get to a satisfactory conclusion somewhere along the line. Thank you.
Thank you, Councillor Thompson. Next we have Councillor Adam Gannon.
Thank you, Chair, and of course, good luck in your year ahead as Chair of this very important committee. I was thinking as the conversation unfolded there, obviously there's a lot of GPs and practices that are struggling across this district, and you're not going to go into the specifics of naming different areas for obvious reasons, Neil. But in terms of these policies that you mentioned you're developing, the policies and procedures in terms of managing this GP, is the Trust developing them with a view to making sure they're obviously robust, but in a situation that they could be used again should the Trust be required to step in? So are the policies that are being developed in such a way that they'll be usable in future situations if need be? And Neil, you said obviously you don't see this as the ideal solution or the perfect solution to the problem. Just while we've got you, what would you see as the solution to this problem at this stage? Obviously, training more doctors and incentivizing them to stay here would be a good start, but I don't think that, as we all know, that won't happen quickly. So in terms of those policies that are being developed with kind of a long-term view that they could be used again, and in terms of what do you think the solution should be, Neil, in terms of how can we lobby to help us to assist you in lobbying to try and get these solutions to these problems?
Okay, in terms of your first question, yes, we will be working policies and procedures in a robust way, which will be transferable. However, Adam, every practice will be different, and policies and procedures have to reflect the working mechanisms within each practice and the structure and the staffing. In relation to the solution clearly isn't, can't be just locums coming in on a week-to-week basis or even a daily basis. That doesn't lead to good the best patient care, optimal patient care. It doesn't lead to the best practice, the sense of community that a GP brings to his practice. So for me, the answer has to be to build up the practice. What we're aiming to do, Adam, to be brutally honest, is to try to build up the practice to make it extremely attractive for any GP who wants to work as a GP in Northern Ireland. We'll be encouraging SPPG to incentivize that in different ways, relocation or whatever it is. And I think that's where the council can come in. Council can weigh in behind that and say, how do the Department of Health propose to make the southern sector of the West more attractive for GPs? Because they're paying it in locums. A locum cost is, we know it from locum medical costs in the Trust. Locum cost will be higher than a GP a standard GP gets. So they're spending the money. It's just a matter of getting them then to recognize that and say this is a problem that needs resolved into the future. So and I think then there's a number of ways in which they can do that, through incentivization. but money isn't the answer to everything either. So it's about trying to get the professional side of the roles, etc., attractive to people as well, and support, etc.
Thanks, Neil, and thank you, Chair, as well.
Thank you, Councillor Gannon. Neil, I'll just mention I fully support interim arrangements for the Trillick and Dromore GP practice. I do have knowledge that there's a number of GP practices under stress, and that they are not at their full complement. And I know that the Western Trust, doesn't have the authority to step in or to ask these questions, but the primary care and the acute services that the Western Trust does provide, it does have a knock-on effect, because there is patients that come and present themselves at A&E or Surge that could be getting their medical treatment in a GP practice, and that just shows the stress that our GPs are under, that they may not have enough hours in the day to see the same patients. There's a number of multi GP practices, and then obviously there's the single GPs. There could be one or two or three GPs in a practice. If one goes off sick, and we're still living in COVID, we are still living with COVID. We're still in a pandemic where people are still getting symptoms and still getting sick, but we may not be losing as many people, but they are interlinked. We have to, with the 16% deficit, the southern sector of the Western Trust does need to be prioritised. And from this group, I think that we will make our views known to the department, and that we have to be prioritised. We are not going, we are a community-based council area from Anna and Oma, and I hope that the Western Trust feels that as well. But you come in, you're part of our community, you get better living, better lifestyle. We may not be in an near an airport, but we could get it. We might get St. Angelo up and going and get flights away. But after the weather yesterday, I don't think we need to go to any foreign countries. I think it was warm enough here. So just that it is we have to work on this. The deficit that we have of GPs, it's not sustainable, and I just want to make sure that in the next 6 months that you are making it more attractive for a GP to come into Trillick and Dromore, and then we will highlight the other issues for our other GP practices. So thank you.
Thanks, John. I suppose I would agree. There's two sides to this. One is we were stepping in to protect the patients, but let's be clear. If primary care fails in Dromore and Trillick, then the health service, the trust, feels the aftermath of that through our emergency departments and access to all our other services. So we're joined at the hip here. So we are committed to it.
Thank you. I have no other members indicating, so we will move on. And thank you very much, Neil and the other trust members for answering the questions and providing an update. I did forget about apologies, so I have an apology from Councillor Swift and John Boyle, Director. So if they could be noted, just for Councillor Maguire.
Just on the apologies, one from Councillor Stephen McCann as well, Chair.
Thank you, Councillor Maguire. That'll be noted. Any other apologies, members? No. So thank you very much, and apologise for missing that one. So we'll move on to item number 7, is to receive an update on the capital investment proposals for Carrickmore Health Centre.
Yes, Chair, we have written to the department on this matter, and we had advised of the meeting, so we haven't received a response as yet, so we will follow up on that. And members may also recall that a few weeks ago now you'd met with Dr. Margaret O'Brien and colleagues, and this was actually included on the agenda, but due to time pressures it wasn't reached. So we'd also alerted Dr. O'Brien to today's meeting, but she wasn't available. So really just to know, Chair, we've made the written representations and we will provide members with an update when we receive a response.
That's okay. Councillor Barry McElduff.
Yeah. Okay, thank you, Chair. As members of this subcommittee or committee, we're invited, to itemise issues that are important to us. So I had itemised this one, took a wee while to get around till itemising it because of meetings running on and such things. But I suppose for a long time now, I think it was always Lisnaskea and Carrickmore were identified as the two rural practices that needed capital build, And when you hear the numbers of patients in these practices, they're quite amazing, So I'll deal with Carrickmore. I think Lisnaskea has been resolved, isn't that right? Or is being resolved. But Carrickmore maybe lags behind, and trying to understand how does it work in the system, who does what. Eugene Gallagher used to be somebody that I contacted in the Western Health and Social Services Board about this matter, and that might be 15, 20 years ago. So who decides, who has the decision-making power here to invest capital or not to invest capital in, for example, Carrickmore Health Centre? And I think the catchment now takes in more than 10,000 patients, and you have a building that is not fit for purpose. So it's a very legitimate question on the tips of everybody's tongues is when will we get proper capital new build in Carrickmore to serve that big, expansive mid-Tyrone practice? Thank you, Chair.
Thank you, Councillor.
If I can come in there,
Neil,
Chair,
go ahead.
The capital prioritisation for Northern Ireland Health and Social Care would be part of the Department of Health. They will have a 10-year capital programme. Barry, Lisnaskea is on that programme, so yes, it's resolved in that regard, and the money set aside for it. It's my understanding, and maybe Emer can correct me if I'm wrong. However, Carrickmore isn't at this stage, so we will continue to lobby on that basis. We would put forward bids to the department for capital allocations, and we will have to compete here against the rest of the province. So, I would say, folks, we've done very well from a notwithstanding if you were sitting in Carrickmore practice facility, you mightn't really see that, but as a trust area, we've done extremely well from capital developments over the last 15, 20 years. So we have to be careful. We will keep pushing, and we'll always chance our luck. We'll always try to keep poking away to get maximum investment into the West. But at this stage, the Lisnaskea is the priority capital development over the next couple of years.
Thank you, Neil. Are you happy, Barry?
I don't think you're happy with
this.
Just... You're mute.
Mute, Barry.
Content, I think, it's about content.
But, we'll agree with that then. We'll agree with content.
What's the input of the GPs themselves? In the sense that GP practices are like mini businesses. Maybe that's the wrong description. But what's the input of the GP themselves in matters like this?
They would have a role. I'm sure Josephine can explain more eloquently than me, but GPs can lobby the SPPG. They can either go down the road of buying their own practice and getting various forms of reimbursement from SPPG, or they can put themselves at the hands of the department and ourselves to actually be tenants. So it's up to there's two sides to this, and different GPs practices have done different things over the years.
And then just finally would be, John, if you don't mind, is I think can there be modifications or facilities, additional interim facilities provided, to create more space? Have those types of offers been made, or are they likely to be made to meet the growing demand?
Well, I'm informed, Barry, that we have met with the practice in the last 2 weeks. We've done surveys, we've done analysis of this, and really, if Carrickmore was to get an MDT, well, then we would need to examine leasing options rather than any other option. That would be the only option we would have, to lease an accommodation somewhere else.
Okay.
Far from ideal, but that's just the nature of the building, I think.
Yeah.
It's been a long time since I was in Carrickmore, Barry, so I
Yeah.
can't speak with any. So I must that's another place I'll have to go through.
That's right. I think it's important that you would. Thank you.
Thank you, Councillor McElduff. Councillor Josephine Deehan.
Thank you, Chair. Well, I think Chair Neil referenced earlier in the meeting the role of the Southwest GP Federations in developing, protecting and supporting primary care, and he's quite right in that. In terms of investment into primary care has always been the Cinderella service, and we have been lobbying over many years for increased investment in primary care, including investment in premises. One of the reasons that we are in the crisis that we're in the Southwest area in primary care is because of that lack of investment. And members will be aware, Chair, that as a council, as a committee, we have lobbied very extensively for the rollout of the multidisciplinary teams and to the southwest of the trust area, and we are at present second on the priority list for that. But there are 3 limiting factors, and one of the money, premises, and staff. But premises is a major factor, because if you're going to be introducing numbers of supporting professionals like physiotherapists, social workers, and so on, then you need to have somewhere where they can use as a consulting room. And currently we don't have that. Now, I have to commend the Western Trust. I mean, I practice from Omagh Hospital and Primary Care Complex, and we have excellent facilities, which I appreciate. The Trust has been proactive in developing additional accommodation for primary care, including spaces where multidisciplinary teams can work. But we are concerned regarding rural practices like Carrickmore, and if they are successful in getting multidisciplinary teams, where are they going to go? So, I think that we have to be very aware of the challenges that face us. So if we can get the financial resources, if we can get the premises that we require, and then finally the staffing. And if we can get all those ducks in a row, then we have some hope of saving primary care in this area. So the challenges are huge, but premises is a huge issue and one that needs to be pushed very hard. And I do want to express my appreciation for the progress that has been made in the Omagh Primary Care Complex. And I look forward to seeing the outworkings of that, Chair. Thank you.
I suppose, Chair, I do have to, this is going to sound quite negative, but it isn't meant to be. It's under government rules, folks, we're not allowed to spend money in what is called in advance of need. So we can't actually go out and buy a building or develop a building or extend a building prior to Minister approving the MDT, because that would be acting in advance of ministerial approval. We wouldn't get approval for the business case anyway, but that's just one of the rules that we have to operate within. So Josephine's right, premises are important. We'll do all we can to scope and to identify the need and identify the options, so that at least the time frame between approval and getting the premises in place will be as short as possible. And that's about as much as we can do at this stage.
Thank you, Councillor Deehan. Yeah, Neil, premises, GP premises are vitally important, and like people in Lisnaskea have waited over 10 years to get, to get to this stage, and people in Carrickmore need to, they need a premises you know, there has to be foresight, you know, within the Department of Health. Like, it's not the Western Trust, you know, that's doing this. Like, we're moving now, as Councillor Deehan says, about multidisciplinary teams, and you don't have enough space. You don't, you know, to get all your patients in, you know, the ones that are sick, ones that need to be rehabilitated and into spaces and into, you know, to get them back to full health. It's a minefield, but you know, maybe it needs to be simplified, and that people that in the department will see that something has to be done and it needs to have foresight into the future. So thank you. We've no other members indicating, so we will move on from that item. And item number 8 is correspondence. We don't have any correspondence. Item number 9 is any urgent relevant business. Well, since nobody knew I was the chair, you just couldn't contact me. So if I'll have some leniency if you have anything you would like to raise. No, you are very good today, like, so I'll the next time you could be thinking. So then item number is confidential business if required. Alison or any of the trust?
No, just to confirm, Chair, we have no confidential items, and I don't understand there to be any from the trust either, so that will conclude the business.
Okay, so thank you very much, members and staff from the Western Trust, and thank you for your kind words and me being appointed chair. So till the next meeting, I will look forward and have a nice afternoon and evening.
Cheers.
Thank you,
All
Chair.
the best, folks.
Thank you, Chair.
Thanks, Chair. Bye.
Bye-bye.
Bye.